Assalamu alaikum. This is Moiz. My roll number is EP1770043. Today I'm going to explain the experimental data of anticoagulant drugs used in animal model. We have to understand that anticoagulants and antiplatelet drugs eliminate or reduce the risk of blood clots. They are often called blood thinners, but these medications do not really thin your blood. Instead, they help prevent or break up dangerous blood clots that form in your blood vessels or heart. Without treatment, these clots can block your circulation and lead to a heart attack or stroke. What these drugs do: both antiplatelets and anticoagulants work to prevent clots in your blood vessels, but they work in different ways. For example, antiplatelets interfere with the binding of platelets, or the process that actually starts the formation of blood clots. But anticoagulants interfere with the proteins in your blood that are involved in the coagulation process. These proteins are called factors. Different anticoagulants interfere with different factors to prevent clotting. There are some anticoagulant drugs including heparin, warfarin, rivaroxaban, dabigatran, apixaban, edoxaban, enoxaparin, fondaparinux, etc. But we have three types of drugs including rivaroxaban. It inhibits free and clot bound factor 10A, and the biological effect of rivaroxaban is 6 to 7 hours. Next one is dabigatran. It is a potent synthetic reversible non-peptide thrombin inhibitor, generally about 24 hours after the patient's last dose. Next one is Apixaban. It selectively inhibits the activated factor 10A in a reversible manner. It inhibits both free factor 10A and also clot bound factor 10A. Inhibition of factor 10A also leads to reduced formation of factor 2. Now we have to understand that the analytical data, which is based on the appropriate selection, sampling, and storage of biological samples meant for estimation of drug levels, is important. Yet sometimes overlooked in day-to-day practice, blood is one of the most important specimens of clinical interest, and it provides unique advantages over other matrices in terms of wide variety of measurements possible. The vast amount of published data for both antemortem and postmortem drug level analysis and the interpretive value of the matrix from a pharmacological standpoint. Blood samples can be collected in tubes having a wide range of options for preservatives, anticoagulants, and other additives, and subsequently stored at room temperature, refrigerator, or frozen. The purpose obviously is to maintain the sample and the drug or its metabolites of interest in a state that will not degrade from the time of collection to the time of analysis. Needless to say, drug testing labs have to develop methodologies for sample analysis that allows accurate estimation and interpretation of the data. For instance, interaction between drugs and the type of collection tube used is not uncommon and should be accounted for during analytical method development. Accurate determination of drug levels in human blood samples or animal model samples in clinical trials and routine patients care is extremely important. For instance, therapeutic drug monitoring guides further dose selection of a drug based on levels achieved at previous doses. If doses are modified based on incorrectly reported drug levels, it could lead to subtherapeutic levels or potential toxicity. For anti-cancer drugs and some antimicrobials with narrow therapeutic window and high toxicity, appropriate determination of analyte is vital for TDM. Now, we have to understand that careful selection of anticoagulant is necessary for accurate characterization of pharmacokinetics of drugs. Because pharmacokinetic studies are vital in development and optimization of drugs. While blood samples can be collected either in EDTA, heparin, or citrate containing tubes for the estimation of drug levels in plasma, EDTA tubes are more commonly used. The purpose of this study was to evaluate the effects of anticoagulants on bioanalysis of drugs. Thank you. Thank you very much.